Before watching my video, please subscribe my channel. Okay, let's start. Setting: General Practitioner Clinic. You are speaking to a 40-year-old man who has come to the clinic for a routine checkup. He is traveling overseas next month with work, and the general practitioner has asked you to advise him on recommended travel immunizations prior to international travel.
Good morning. Thanks for coming to see me. My name is Gurleen, and I am the clinic nurse. What do you prefer to be called?
Hello, Gurleen. You can call me Tim.
Okay, Tim. The doctor has informed me that you will be traveling overseas next month. Is that right?
Yes, that's correct. I work as the international business manager, and my company is sending me to Cambodia and Vietnam next month.
I see. How long are you going for?
I suppose I will be gone for around 4 weeks.
Okay. The doctor has asked me to ensure that your vaccinations are up to date before your trip. So, can I ask you some questions about your immunization history?
Yes, absolutely.
Could you tell me when you received immunizations for tetanus, flu, and hepatitis A?
Well, I have been fairly regular with my flu shots every year. In fact, I got one earlier this year. About the rest, let me see. I do not accurately remember, since I do not have my immunization record, but I do remember that I was vaccinated against tetanus and hepatitis A and B in my childhood, you can say about 30 years ago.
Okay. So, what you are saying is that you have had a flu vaccine earlier this year and have not repeated vaccines for hepatitis A and B or tetanus since your childhood. Is that right?
Yes, that sounds good.
Alright. Since you are traveling to Cambodia and Vietnam, which are both medium-risk countries, as per the World Health Organization, I would advise you to update your vaccinations for tetanus, hepatitis A, and typhoid.
Oh no, do I really need to get all these? I mean, I have been managing pretty well all these years. I do not understand why I need to go through the hassle of getting these again. In addition, my company has arranged my stay at a 5-star resort, so I do not see a reason to worry.
Yes, I understand what you are saying, and your point is well taken. Nevertheless, it is crucial for your protection to get these immunizations. This is because there is a moderate to high risk of these diseases if you are traveling to Cambodia and Vietnam, and a simple and effective way to prevent these diseases is vaccination. While I understand that you were vaccinated during your childhood and have been managing well, some vaccines need to be repeated after a few years as their efficacy is limited.
Is that so? I was not aware of this. I always thought that they are effective for a lifetime and I have lifelong immunity.
No, you need to update your vaccinations for tetanus, typhoid, and hepatitis A. A tetanus vaccination needs to be updated once every 10 years, and it's paramount that you are vaccinated against tetanus because it can be lethal and dangerous. We can give you a combined vaccination for hepatitis A and typhoid, which should give you immunity against these during your trip. Once you are back, you can come back for a booster dose after 6 months.
Right. So, you suggest that I get these before traveling?
Yes, it is also important to ensure that there is a gap of at least 2 weeks between your vaccination and travel dates.
That does not leave me with much time. I suppose I need to get the vaccinations either this week or the next.
That's right. Just like eating well and exercising, right vaccination is the cornerstone of maintaining good health.
Oh well, you do have a point, but you see, I hate injections and needles. It's painful and uncomfortable.
It's understandable. It's totally normal to feel a little anxious, uneasy and hesitant about getting injections. But as with most things, having a positive attitude will make the experience easier. In fact, it's not as painful as anticipated and the pain is generally tolerable. You might feel a little pinch and some pressure. If it hurts, it will hurt only for a short time.
Okay, I don't think I have a choice. So, I might just get it over with.
Would you be willing to get these vaccinations today?
Well, okay, I think I will get the vaccinations today. After all, how hard can it be, right?
Exactly. I am glad that you agree. Please wait here, and I will be back shortly with the vaccines. If you like my video, please subscribe, and press the notifications bell. Thank you all.